A new cancer treatment has achieved near-complete tumor regression in just 5 days, in what scientists have hailed as dramatic and rapid results. Clinical trials of a novel treatment on patients with aggressive cancer glioblastoma have revolutionized the way scientists think about treating patients. Researchers from the Mass General Cancer Center, Massachusetts, have shared the results for the first 3 patients in a clinical trial of CAR-T therapy for glioblastoma, GBM. Glioblastomas are a fast-growing type of brain tumor, which are the most common type of cancerous brain tumor in adults. CAR-T therapy works by using a patient's own cells to fight cancer, and is known as the most personalized way to treat the disease. A patient's cells are extracted, modified to produce proteins on their surface, and then injected back into the body to target the tumor directly. The trial, known as Incipient, was designed to evaluate the safety of CAR-3T cells in patients with recurrent GBM. CAR-T therapies have been approved for the treatment of blood cancers, but the therapy's use for solid tumors is limited. Solid tumors contain mixed populations of cells, allowing some cancer cells to continue to evade the immune system's detection, even after treatment with CAR-T. The research team came up with a plan to tackle this problem by merging 2 previously separate strategies: CAR-T and bispecific antibodies, also known as T-cell engaging antibody molecules, TEAMs. The version of CAR-T for glioblastoma is made to be directly injected into a patient's brain. This combined method showed promise in early tests on models of glioblastoma, which inspired the research team to take it to clinical trials. 3 patients took part in the study, which was published in the New England Journal of Medicine, between March 2023 and July 2023. The T-cells of the patients were collected and changed into the new version of CAR-T cells, which were then put back into each patient. The patients handled the infusions well, although nearly all had fevers and altered mental status soon after infusion. Just days after a single treatment, patients saw dramatic reductions in their tumors, with one patient achieving near-complete tumor regression in 5 days after one treatment. Assistant Professor Brian Choi from Harvard Medical School said, "This is a story of bench-to-bedside therapy, with a novel cell therapy designed in the laboratories of Massachusetts General Hospital and translated for patient use within 5 years, to meet an urgent need." The CAR-T platform has revolutionized how we think about treating patients with cancer, but solid tumors like glioblastoma have remained challenging to treat because not all cancer cells are exactly alike and cells within the tumor vary. Our approach combines 2 forms of therapy, allowing us to treat glioblastoma in a broader, potentially more effective way. One of the patients, a 72-year-old man, saw a 60.7% decrease in his tumor, which was sustained for 6 months, while a 57-year-old woman had near-complete tumor regression only 5 days after a single infusion. The team say that their results are exciting, but that much more research is needed to fine-tune this treatment. Associate Professor Marcella Maus, director of the Cellular Immunotherapy Program at the Mass General Cancer Center, added, "We've made an investment in developing the team to enable translation of our innovations in immunotherapy from our lab to the clinic, to transform care for patients with cancer. These results are exciting, but they are also just the beginning. They tell us that we are on the right track in pursuing a therapy that has the potential to change the outlook for this intractable disease. We haven't cured patients yet, but that is our audacious goal." Co-author Dr. Elizabeth Gerstner concluded, "We reported dramatic and rapid response in these 3 patients. Our work to date shows signs that we are making progress, but there is more to do. Don't miss the latest news from around Scotland and beyond. Sign up to our daily newsletter.